So when we're talking about rocker bottom foot deformity, like we were just looking at, what should be happening is there should be an arch here with all of these bones up off of the floor, but in this case of this young man, because of how tight his heel cord, the Achilles tendon is, that pulls up on the calcaneus, on the heel bone, where it is attached here, which causes the arch to collapse down. And so when you see him standing and walking, the heel is really very minimal, or sometimes not any contact with the floor on the heel, but all of the weight bearing is occurring down through the arch here because of this happening. And so it's called rocker bottom foot deformity because the bottom of the foot is shaped kind of like a rocking chair. And what it indicates is that this heel cord is pulling so hard on the heel, and this structure has become so stretched out and so loose that it's collapsing all the way down to the floor and standing entirely on the midfoot. Okay, so this is the foot we're looking at here, and as I pull, he's sitting with his knee bent right now, so his range is a little bit better, but you can kind of see when I come down, see the heel moving, and then when I come up so far that it stops right there, and then all of the extra movement is coming from the joints right through the middle of the foot. So the heel stops plantar flexing at that point right there, and then all of this is movement coming from the middle part of his foot. So as he's standing, the heel is plantar flexed and up in the air posteriorly, and then this foot is collapsing right down like that, creating this rocker bottom position that we can see. So what needs to happen, and it's very difficult, is the heel cord, which attaches here onto the calcaneus up to the calf muscle. This heel needs to actually be pulled down. Right now, when we're looking at it, it's kind of up like that. We need to even pull that down to try to stretch out this musculature. So to stretch, what we want to do is push these bones in the middle part of the foot, which are collapsed down. We're going to push those up, and at the same time we're pulling down on the heel. So we essentially pull right down on the heel, like I'm doing with my fingers there, while I'm pushing up on his arch to push the navicular and the talus back into position. And when I actually check his range, when these bones are in a neutral position, the actual range of motion at the ankle is about right there as far as that goes. Before, if I try to go further, it's not movement coming from the ankle joint, it's movement coming from the mid-tarsal and the subtalar joint. Well, that is a rocker bottom foot, and our goal is to try to maintain the support and the correction of the bones and joints in the middle part of the foot while stretching the contracted Achilles tendon and calf muscle. Very difficult to do once this foot structure is broken down this far, but that's the challenge. If you're interested in learning more about pediatric orthotic care and how to help children who are struggling with mobility, please check out our website, pediatricrehablab.com. I put together a course there, both for parents and for medical providers, to help them be able to help kids who are struggling. If your child or your patient is already working with pediatric orthotics, then you know that they can either be an enormous help or a daily painful struggle. And so I want to make sure that every parent and every medical provider has all of the information available in order to help their children the best way possible.